Thank you. It's a pleasure to be here. I hope we have many synergies for the future, and I'm going to share a little bit of our history back from Brazil. So, we are Portal Telemedicine. We are an online telediagnostic and monitoring platform. Our customers are clinics, hospitals, companies, and governments. We've been running through 8 years now. This is our 9th year. And here I'm going to share with you a little bit more on how we do deliver diagnostic in a way that we use IoT, machine learning, and cloud to enable a large-scale telemedicine operation. So my background is around IoT and cloud services, around data science, and together with all of these technologies, we are able to deliver this to millions of patients around Brazil nowadays, being the one top telemedicine company around our country. The main problems that our company tries to solve is the lack of access, inefficiency, and low accuracy. These problems are handled with many different types of technologies, and here is a user case so you can understand a little bit more of what we do. So here you can see Coari in the northwest of Brazil. It's a really remote place where you can't find any medical specialist or general physician. You have just one general physician in a small island that you can only get 24 hours by boat traveling to this Coari city, where you have many villagers, many indigenous citizens, just like Paulo here. So Paulo is an indigenous citizen that had a disease, a condition that no one could find the cause. He was in the bed for 2 months, and then he went to CEMOC. There is a small clinic over there that is connected to our services. So we do everything remotely. We install our services remotely, and Paulo had an EKG, an electrocardiogram, where it measures his heart activity, and we get this information and upload to the cloud. We encrypt and upload to the cloud directly from the device. So directly from the medical equipment, we get this information to one of the top cardiologists in Brazil. This top cardiologist provides the diagnostic back, saying that his pacemaker inside his heart was malfunctioning. So that's why it wasn't a disease, it was malfunctioning from the device inside his heart. So this led him directly to surgery and saved his life, showing once again how impactful our solution could be. We enable this by a proprietary technology. So we integrate with medical devices, EHR, radiology in general, EKGs, EEGs, electroencephalograms, cardiograms, spirometers. We integrate more than 90% of all brands of medical devices now in Brazil. And we have all of these integrations easily done for many other types of manufacturers. So we deliver this interoperability between all of these systems already with HIPAA and GDPR compliance. We get this data, we encrypt and upload this data to the cloud. And nowadays, we have more than 100 million exams database, one of the largest data sets. You can find the structure around healthcare, even worldwide. And with this information, we pass through a multi-web platform where you have a lot of increased productivity because of all of this data, where you can show to doctors or even to managers from hospitals or even to the government, since we did this together with some jurisdictions in Brazil. So this enabled us to create, to grow pretty fast and create many solutions for more than 700 cities around Brazil. Nowadays, we do more than 4,000 to 5,000 diagnostics every day. So this is more than any hospital around the world, but of course, it's spread in all through those cities, every state, and more than 1,000 to 2,000 customers nowadays. So with this information, we were able to create a lot of opportunities to the market from Brazil, and we believe strongly that Japan could benefit from this technology if we use to create a more affordable healthcare, or as a population health management tool, where you can see the whole journey for patients and you can see all of the points for data, even if you are from the federal government or for a small jurisdiction, for a province, for example, or just a private company. With this information, we could help São Paulo, for example, that's the biggest state in Brazil. We got all of the data points and abnormality points where you can see the cost benefits for a hospital and clinic, how much it costs a journey for a patient. If we are talking about a research project, for example, we are doing a research project focused on child development, where you can see these abnormality points where children are having diabetes, for example, and the country is not developing this well, just giving meds, for example, for diabetes, and this increases a lot the costs for, of course, just a child having meds for diabetes. You can imagine how this is going to cost if he gets the same disease for 20, 30, 40 years old, and etc. And for and so on. So with this information, of course, we can help the patient to be located in many different hospitals. We gather together with a research foundation and university and some big tech companies. Together with our R&D grants, we've been for 26 R&D grants already, and we gather this information in a patient journey where you can see this patient with many different types of algorithms and find him by his mother's name, his father's name, or even by the image, since we did a lot of research in R&D as well, to create a hub that can integrate these many types of systems together and give this to a hospital system or even to a government. So this is a white label tool that can be used for these institutions or governments. And we support, of course, the doctor in the point by using a lot of tools to increase their productivity. So nowadays, doctors don't have to type anymore. They only look to this tool, and of course, we gather the information from all the past hundreds of millions of exams that we got to create decision tree-based buttons where they just have to click tachycardia, next, arrhythmia, next, normal, diagnose. And only with these clicks, we increased more than 10 times the productivity, dropped the price point to sell to the clinics with a smaller price. So for example, we can deliver an electrocardiogram diagnosed for a top cardiologist for $2 nowadays, and even get margin on this. So we are more affordable because of this. We can get smaller clinics in remote places, and also, of course, bring doctors to work with us, even top doctors to be with their families in their home, other than just being with a lot of paper and different systems in their daily basis. So together with this, we have pairs of exams and labels. With this, we created machine learning models, and we pass through this a deep convolutional neural network that creates a triage, moving up or down the queue emergencies and helping the doctor to don't make mistakes, because he will always have the support of the AI in the end. With this, we created a lot of explainability to show to doctors on how we do this, and created groups of people so you can understand better how the data is affected by the government or the hospital or the treatment itself, and of course with this cost benefit as well. And last but not least, we created a teleconsultation tool that also integrates directly with all of these devices and the patient journey, so doctors can use this with ease, and of course have a teleconsultation by distance. With a huge ecosystem of partners, this is our team and our mission to collaborate with the universal access to quality healthcare. Thank you.
Okay, thank you very much for that.